Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Hello everyone. Hello. Hello everyone. Yes, welcome to Pediatrics by Dr. Anand. Is my solitary voice audible to everyone? मुझे खुद ही आ रही है. Yes, I assume that my voice is audible and I just came back from gym and what you guys did in the evening, let me know. We have so many people online. What's up? Hello. Yes. My name is Dr. Anand. I'm MD Pediatrics. This is the beautiful Unacademy NEET PG platform. First of all, this is the beautiful Unacademy NEET PG platform. My name is Dr. Anand. And in this beautiful platform, what is the benefit of choosing Unacademy? Most importantly, number one, we have a lot of tests in Unacademy. We have some amazing free test calendar we have in the Unacademy, and I recommend every one of you to participate in a lot of tests. Also in the Unacademy, we are launching a previous year question bank. Question bank is must, okay? If you want to get crack good seat, then a lot of last 3 year question papers. We have done videos on last 3 year question papers from INI-CET, from what you call the FMG, from NEET PG, all the amazing segments we have taken. So you must watch the last 3 year question bank papers videos. This also we are launching a previous year question bank. Also in this beautiful life, light रहें, light सोचे और हमेशा light रहें जीवन में. In the Unacademy, most importantly, we have a plan known as Unacademy Light, which is basically happening for 2 months. And most importantly, in this beautiful what you called plan, just 2 months you get some amazing practice tests and everything, which is really helpful for you. Also, the NEET PG end of the sale. Today is March 31st, last day, last sale, 20% off from tomorrow. This plan from midnight only. This plan is off. This is the duration month wise. This is the old price, this is the new price. And whenever you want to unlock this thing, you have to use any educator's code. As my name is Dr. Anand, the code is Dr. Anand. You can use any other educator's code also, no problem. Also, we are launching very beautiful MBBS Prof 1 batch. A lot of students from the MBBS basically segment, they want to join our Unacademy platform, and that's what. And here you have this amazing what you called MBBS Prof batch for the next exams. Also, we have a beautiful doubt clarification series, my dear friends. Hello, Osama. Hello, Surjana. Hello, Manoj, RR, Nishashri, Saurabh, Zainab Akhtar, and amazing, beautiful people. Let's start this beautiful class. And this doubt clarification series is for people who have read nicely and have some smart doubts. You can ask me anytime. Also, in the Unacademy, we have something known as Plus subscription, where you get amazing access to our live and recorded classes. Educators are really good. The test qualities are amazing. And also, we have something known as Iconic subscription, where you have the Unacademy platform and the Prep Ladder subscription. All the clinical notes, video lectures, question bank, everything you get on the Iconic subscription. Congratulations to the amazing people who work really hard and they deserve to be on this stage. Now I want you all people, Aishwarya, our Osama Sheikh, RR Nishashri, Pancake, and the lost. We have a lot of amazing people like Shubhangi, Shagufta, Srujana, and also our Jappu Panchal. How to pronounce your name, I don't know. I want your names to be there, okay? Get rank 1. You are very close to exam. It's awesome. Be thrilled. I am excited. Are you excited? That's the question. If you are new to Unacademy, download Unacademy app because it has some amazing features like special class, putting polls together. So it's amazing, and you never miss the lectures because all the classes are recorded, and the lecture notes. Notes is something we always wish, right? You get the notes also in the classes. We have made a beautiful NEET PG 2022 batch, most importantly, and a special batch for the FMG students also we have made, which is always very fruitful. That's it. Let's start the amazing class. Hello Chakravarti, hello Aishwarya, Zainab, an amazing million people watching us together. Yes, Oscar also wants to come. Okay, great. So yes, let's start the beautiful class. Before starting any amazing segment, we always have a motivating quote. And today's motivating quote is, it is during the darkest hour. It is during the darkest hour we must learn to see the light. It is during the darkest hour we must learn to see the light. The light. Which light? The light of hope. The light of positivity. the light of hope that everything will be fine, the light of hope that you are amazing, you have worked really hard, and the light that everything is possible, everything is possible in this life, in this planet. You have worked so hard, you are very, very, very close to the NEET PG paper, and even the FMGs and also the INICT students, you have worked really nicely. So don't lose hope, don't lose focus, you will get it. You were born to get it. Just chill, just chill. In this segment, I want good, amazing, positive vibes. Most importantly, if you are a newcomer, watch my class and make notes. If you're an old comer, then most importantly, answer. Sit with your mobile, sit with your laptop, and sit with your iPad and keep answering whatever questions I'm putting at you. Try to answer as fast as possible. Okay, great. Best of luck. Let's start. Vaccines. Today's topic of choice is very, very nice topic. Vaccines. Okay, and we have in this next 30 minutes, we're gonna cover like as fast as possible in the vaccine. Can anyone tell me what is the definition of vaccine? Why do you give vaccine to me? Let's discuss about it. It's a discussion session. I want you all to participate as much as possible. Okay, exactly. So Surujana, Swaraj, Chakravarti, and Zainab Akhtar, Aishwarya, and Osama and Saman, what do you think? What is a vaccine? क्यों देते हैं? Why do you want to give vaccine to me? Why COVID vaccine are you giving me? Why are you giving me BCG vaccine? Why every newborn is given vaccines? Because most importantly, vaccine is a substance. Vaccine is a substance that used to stimulate the production of antibodies and provide immunity against the disease. Do you agree with me? Yes or no? Vishal Singh is right. To get immunization, we give vaccine. It's a discussion topic. Please relax your brains. Just relax. Breathe. Breathe. What is vaccine? It is a substance that used to stimulate the production of antibodies. Small, in a very small dose, I give vaccine, nothing but I give antigen, and my body will make what against the antigen? Antibodies, yes or no? So vaccine is a substance used to stimulate the production of antibodies, yes, and provide immunity against the diseases. That is nothing but definition of vaccine. Number one, ये जो है basically हमें antibodies production में help करता है. It is used to stimulate the production of antibodies. That's basic stuff we need to know. What are the various types of vaccine? Yes. Can anyone tell me what are the various types of vaccines? Arvind Kumar, Pratibha, Sonali. Okay, we have this one. Yeah, Srujna is saying, do you have German Shepherd? No, dear, I have two dogs. One is our Oscar. His name is Oscar. Oscar, the breed is Beagle. And my sister stays opposite to her house. She has what you call golden retriever. His name is Bunny. Both are male doggies, and one is Bunny, one is Oscar. Bunny is golden retriever, and Oscar is Beagle breed. It's amazing. Like you, before buying any dog, ask me. Okay, like my family, they love dogs. We had this German Shepherd. We also had Labrador, Dalmatian, Pug. All doggies we had before. Perfect. So various types of vaccines are. If we have a mnemonic. So if anyone has seen Game of Thrones, anyone has seen Game of Thrones, we had the family of Stark. We have the family of Stark in Game of Thrones. So S for subunit vaccine. Very beautifully, people are answering back to back. S for subunit vaccine, T for toxoid vaccine, A for attenuated vaccine, that is the live attenuated vaccine, R for recombinant vaccine, and K for killed vaccine, K for killed vaccine, and P for polysaccharide vaccine. These are the yes, various types of vaccine: subunit vaccine, toxoid vaccine, live attenuated vaccine, recombinant vaccine, killed vaccine, and polysaccharide vaccine. Stark P. Stark P is the mnemonic in general. If you are a final year MBBS student, if suddenly examiner asks you, tell me what the types of vaccine, sir, and then you can answer STARKP. These are the types of vaccine. So beautifully, Vishal, Swaraj, Sonali, our Osama Sheikh, beautifully answer. Perfect. So this is the Stark P mnemonic we have covered. Now start, I told you subunit vaccine, toxoid, attenuated, R for recombinant, K for killed, okay, and P for polysaccharide. Over. Coming to live attenuated vaccine, can anyone please tell me the various examples of live vaccine? Live पे अगर हम आए तो anyone live bacterial and live viral vaccine, can one example, at least one example of what you called live vaccines? Who will tell me? Anyone? Yeah. So BCG, guys, what is BCG? Osama, is BCG a live vaccine or a killed vaccine? What do you think? Is it a live? Exactly. So beautiful. Pragya Khare, also very regular student in our classes. Manoj Chaudhary, Arvind Bhavani, Swaraj Suman, so beautiful. So yes, we have the in the live vaccine depends, sir. Are you asking me bacterial or viral? At least the take home message, my dear friends, I want from you, my dear friends. Bacterial may please remember BCG, and viral may, have you heard of oral polio vaccine? Have you heard of measles, MMR, chickenpox? All these are viral vaccines. They are live vaccines. Okay. In at least take home message, B for bacterial, B for BCG, live vaccine. Bacterial में BCG, and viral में OPV, MMR, chickenpox. These all things are there. Okay. Beautiful. And don't mind, I'll be taking lot of water in between because I'm having extreme dry throat only, and my ENT has told to take a lot of water. Otherwise, I have to stop taking classes then. So yeah. So most importantly, yes, this part is over, dear. BCG. We are studying vaccines. There are various types of vaccines, and live vaccine example we got it: bacterial and viral. B for bacterial, B for BCG, and viral. I have told you everything: OPV, MMR, chickenpox, measles, and everything. I would like to ask you million questions in between. Don't mind. I'm gonna ask you lot of questions. We have to have study integrated in a very integrated manner. Okay. Measles, Dr. Osama Sheikh, in a very busy OPD, if a measles patient has to come to me, could you please tell me that what are the complaints the measles patient will have? In a very BCG 150 patient, if in a very busy OPD, 150 patients OPD, measles का बच्चा अगर हमको देखना है, if we are expecting a measles baby patient, could you please tell me that how the patient will present? Exactly. Manoj Chaudhary has the best answer. The answer is C, C, and C. Very simple, bro. Cough, coryza, and conjunctivitis. Have you heard of cough, coryza, and conjunctivitis? Very good. Keep answering every single day. I would like to ask you 100 questions per day. And remember, my dear friends, brothers and sisters, this medicine, peds is like medicine only. You are studying medicine. Nephrotic syndrome is there in medicine also. It's there in pediatrics also. Pneumonia, bronchial asthma, tuberculosis, categories, regimen, dog bite, whatever you say, it is there in medicine also. It is there in pediatrics also. So revise till you die. Revise. Okay. So yes. Exactly. Osama has told a very beautiful extra point that the measles patient in a busy OPD will come with cough, coryza, and conjunctivitis. Which type of conjunctivitis you will see in measles? You will see purulent conjunctivitis, because if which is the other disease you see conjunctivitis also? The answer is Kawasaki disease also you see conjunctivitis, but in Kawasaki you will have non-purulent conjunctivitis, whereas in measles you will have purulent conjunctivitis. Purulent matlab pus forming means the mother will complain, doctor, my baby has some reddishness around the eyes, that is conjunctivitis, and also with the reddishness of the eyes, my baby is having some sticky discharge, some sticky discharge is there, doctor. That is purulent conjunctivitis seen in measles, and non-purulent conjunctivitis is seen in Kawasaki. Swaraj and Sonali and Surjana, could you please tell me, Kawasaki, is it a large vessel vasculitis or a medium vessel vasculitis or a small vessel vasculitis? Kawasaki is a large vessel vasculitis or a small vessel vasculitis? गर्मी में ठंडे पानी का अलग ही मजा है. Exactly. Beautiful answer. So most important, Aishwarya says small vessel vasculitis. Okay. Pragya also says small vessel vasculitis. So beautiful answer you're giving, guys. So proud of you. Okay, we have so many students who may say small vessel vasculitis. Very pretty answer, but the answer is wrong. Neither it is a small vessel vasculitis nor it is a large vessel vasculitis. It is a medium vessel vasculitis. मेरा मन ही नहीं क्या सही option डालने का. I didn't feel like putting the right option. I want you to have confidence. So, sir, neither Kawasaki is a large vessel vasculitis or a small vessel vasculitis. It is a medium vessel vasculitis. And other than Kawasaki, do we have any other thing which is a medium vessel vasculitis? So, other than Kawasaki, we have something known as polyarteritis nodosa. We have something known as polyarteritis nodosa, which is also medium vessel vasculitis. So, are we understanding, yes or no? Beautiful. So, Kawasaki and PAN are the medium vessel vasculitis. Coming to further topics of the vaccines. So, what are we studying? Vaccine. What are the types of vaccines? Stark P. Okay. And now in the Star K, we have the killed vaccine. Can anyone at least tell me two examples, just two examples of killed vaccine? Osama, Sura. It's a revision segment, okay? It's a revision class. So try to participate as much as possible. Swaraj, Raj Lakshmi, Surjana, Manoj Chaudhary. Beautiful. Yes. So they are putting extra points. People are saying extra points. Strawberry tongue, it is seen in Kawasaki. Very good. Beautiful answer. Other than Kawasaki, do you see somewhere else also strawberry tongue? I hope we have done that. Osama, bro. Exactly. Even in scarlet fever, also scarlet fever. Scarlet fever, also the baby will have a strawberry tongue. Kawasaki, also baby will have a strawberry tongue. And where do you see strawberry vagina? That also we have done. Strawberry vagina, you will see in which disease? Trichomoniasis. Yes or no? Strawberry tongue, Kawasaki, strawberry vagina, trichomoniasis. Trichomoniasis was already a NEET PG question. It's so important. And also strawberry gingiva, if anyone wants to revise again. Strawberry gingiva. Any idea? Strawberry gingiva कहाँ मिलता है? I really forgot. Can anyone please tell me? Remember, gingiva are small. Gingiva, no, they are small, small. So small vessel vasculitis. Which small vessel vasculitis? The answer is Wagner's granulomatosis. Wagner's granulomatosis will have a small vessel vasculitis. Is Wagner's granulomatosis is a small vessel vasculitis, and you will see strawberry gingiva. So strawberry tongue, Kawasaki and scarlet. Strawberry vagina, trichomoniasis. Strawberry gingiva, Wagner's granulomatosis. These are $1 million questions. These are very, 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 very important question. Every single word coming from my mouth has already been AIMS, NIMHANS, and a JIPMER question. So it's important to attend this class. Perfect. Very good, Swaraj, Sonali, Osama, Mansi, very good. And thank you so much for your good vibes. My health is much, much better now. Now I can scream nicely, but I will not scream. I will only speak normal because I have to teach for a long time. That's why. So beautiful. Yes. So is everyone understanding? Please put a like button to this video, or you can give a sweet, cute heart if you want. समझ में आ रहा है या दिमाग के ऊपर से जा रहा है? Are you able to understand, or it is going? I don't know which language sir is talking. I can't understand. Are you able to understand? These are very important questions. Okay, Aishwarya, beautiful. Yes, very good, doctor. Nice. So in the killed vaccine, guys, very, very important. In the killed vaccine, we have bacterial vaccines and viral vaccine. मोती की तरह हमें एक एक शब्द को पता होना चाहिए. I want you to revise pediatrics 1,000 times, कि मजा आ जाए बस ऐसे आंख बंद करके also you should answer, right? Aishwarya says, superb going, sir. Take care. That's great. Osama Sheikh, thank you very much. Yeah. So yes, please can we revise the killed vaccine, my dear friends? We have bacterial and viral. In the bacterial, we have DTP, or you can say DTWP. Okay. And yeah, what is DTAP and what is DTWP? ये नाम सुना है आपने? मैंने कहीं पढ़ा था. I don't remember this one. What is DTAP and what is DTWP and what is this D and small t? If I write small t, what is the meaning? If I write DTAP, what is the meaning? If I write DTWP, what is the meaning? Simple words, simple answers. I would like to listen from you. Beautiful. Chakravarti is answering so nice. So DTAP is nothing but a cellular pertussis. DTWP is nothing but whole cellular pertussis. So we have a cellular pertussis and we have whole cellular pertussis. And ये छोटे वाला T क्या होता है क्यूट सा? ये कुछ नहीं होता. It is a small dose of tetanus or a reduced dose or a smaller dose or a reduced dose of tetanus. Anything which is small. अगर if I'm writing small d, reduced dose of diphtheria or a smaller dose of diphtheria. Small t is a reduced dose of tetanus. DTAP, AP is acellular pertussis and WP is whole cellular pertussis. We are studying vaccines. It has various types. The killed vaccines are divided into bacterial and viral. Bacterial we have DTP, or you can say even whole cell killed typhoid. Viral में याद रखिएगा rabies virus, IPV. What is IPV? I don't know. Is IPV injectable polio? Injectable बोलते हैं ना? क्या होता है IPV? Who will tell me what is the meaning of IPV? We have Salma, Swaraj, Chakravarti, Osama, Srujana. IPV का मतलब क्या होता है यार? I'm forgetting. I don't know what is IPV. Injectable ही बोलते होंगे शायद. Chakravarti, what do you think? Osama, bro, what do you think? Tell me. Exactly. Priya is right. Inactivated. This actually, my HOD was asking to interns, what is IPV? Get up, tell me what is IPV? Sir, injectable polio vaccine, injectable. So, of course, it is given injectable, but the name is not injectable. It is inactivated polio vaccine. Please remember, my dear friends, it is inactivated polio vaccine. We give injectable form only, but it is inactivated. Remember that. Very good. Then we have hepatitis A and influenza. These are the killed vaccine. These are the killed vaccine. Next, now AIMS 2020 question. This is the AIMS 2020 question. Most important. In the various types of vaccine, we have the T for toxoid vaccine. Could you please tell me that what are the various types of toxoid vaccines we know? Toxoid. दो ही होते हैं. Only two are there, right? So what are the toxoid vaccines and exactly? Yes, okay. We have Neil. Neil also is caring a lot about me. That's so sweet of you, Neil. Thank you. In the evening class also, you had asked me how are you feeling. Now also Neil is saying, क्या मुलेठी की हिंदी क्या होती है मुझे पता नहीं. He's saying about honey. He said take honey. It helped me a lot while I had pharyngitis and sore throat. Okay, yeah. Thank you so much. Yeah, I'm taking honey every day. That's very kind of you. Thank you so much. So yeah, it's a AIMS 2020 question, my dear friends. Toxoid vaccine दो ही होते हैं. Have you heard of tetanus, toxoid vaccine, and diphtheria? Toxoid vaccine, very simple question. So TT and diphtheria toxoid. Exactly. ब्यूटीफुल. अच्छा, हिंदी मुलेठी, हाँ मैंने सुना है कहीं. पूछता हूँ मैं घर वालों से क्या होता है. ठीक है. सो यस, सो व्हाट आर द टॉक्सॉइड वैक्सीन? वी हैव टेटनस टॉक्सॉइड वैक्सीन एंड वी हैव डिप्थीरिया टॉक्सॉइड वैक्सीन. एंड हियर ओनली, बाद में पूछूंगा, ठीक है. वी हैव अमेजिंग मोर क्वेश्चंस आल्सो. सो आई होप यू पार्टिसिपेट as much as possible. Okay, it's gonna be awesome. So yes, so we are studying vaccines. There are various types of vaccine. We have covered the live, killed, and toxoid vaccine. The toxoid vaccines are tetanus toxoid vaccine and diphtheria toxoid vaccine. My mobile battery is only 1%. I'm gonna charge the phone. Subunit vaccine. Could you please tell me what are the various subunit vaccines? Anyone? What are the various subunit vaccines? Who will tell me? Anyone? Subunit vaccines? Yes, very good, very good. Subunit के एक नाम. Suraj and Sonali saying, take ginger with honey, it helps. Okay, tonight I will take ginger with honey. Okay, thank you. Yes, ginger chai also very nice. और कोई चाय I don't take tea, but if you say, I'll take it. Yes, so in the subunit vaccine, guys, we have again bacterial and viral. मोती की तरह very beautifully crystal clear. Your mind should be thinking about it. In the subunit vaccines, we have bacterial and viral. In the bacterial, we have acellular pertussis. Acellular pertussis is the subunit vaccine. And viral, we have influenza virus or recombinant hepatitis B virus. These are the viral subunit vaccine. What is the definition of subunit vaccine? It's gonna come in the further slides. At least allow your brains for this information that acellular pertussis in the bacterial and influenza virus, hepatitis B virus, recombinant wala, that is the subunit vaccine. Perfect. And last but not the least, we have polysaccharide vaccine. We have meningococcal vaccine, pneumococcal vaccine, salmonella typhi wala vaccine, even Hib also. What is Hib? HIB? I don't know what is Hib. What is Hib? Can anyone please tell me what is Hib? Any person? Swaraj? Very good. Very good. देखो बोल दो मेरा चार्जर ले आएंगे. 1% बैटरी. चार्जर भाभी के पास है शायद मेरा. So yes, it's getting stuck. Okay, is my voice coming to everyone? Please let me know. It could be a small glitch for the internet connection. मेरे को तो आ रहा है आवाज. Is my voice coming for everyone? Yes. Hib is nothing but Haemophilus influenza B. Hib is nothing but Haemophilus influenza B vaccine. Very good, Haemophilus influenza B. Perfect answer. Now, what is recombinant vaccine and what are the various examples of recombinant vaccine? Back to back, so beautifully we're gonna cover. Okay, I hope my voice is clear to everyone. I hope there is no internet issue. If it is there also, like within 5 seconds, it will automatically be normal. So okay, so don't mind. Perfect, Priya. Recombinant vaccine का मतलब क्या होता है और क्या examples होते हैं? What is the definition of recombinant vaccine and what are the examples? Recombinant means vaccines produced from genetic engineering. The vaccines produced from the genetic engineering is known as the recombinant vaccines. And we have various recombinant vaccines. For example, अभी हमने पढ़ा था very importantly HPV also, Hib also. Just now I asked you what is Hib. So Hib also, yes, very beautifully, it's a recombinant vaccine. We have hepatitis B, HPV, basically these all are recombinant vaccines. Try to what you called, allow your brains for this information. समझ के पढ़ो, keep it very light. Stress नहीं लेना. You already taking lot of stress because of your exams. Don't take stress. Keep it light. Keep it very light. If you think from relaxed brains, you will really score very high marks. And most importantly, my dear friends, control your heart rate. Control. मैं बोल रहा हूँ, सच बता रहा हूँ मैं. It's not about finishing the whole 100% syllabus. It was never about finishing the whole 100% syllabus. It was about reading the high yield topics. It was about finishing the last 5 year question papers. It was about reading the very, very important stuff. The important topics which were there in 2005 are same in 2022 also. So you don't have to study from page 1 to page last. You have to study the most important and amazing part, and that's what we are doing. Great. So yeah, very nice question, very nice question. Okay, I have a question. I have a lot of questions. Question number one, I am. In general, I'm asking this question. Newborn baby the newborn baby, do we have some injection which we give intramuscular to a newborn? To a newborn, okay? Do we have some injection which we give to the newborn intramuscular? And don't mind if I'm having water, I'm having dry throat, that's why I'm having water. So, do we have any injection which we give to the newborn intramuscular? Very beautiful picture, 90-degree wala angle. What do we, vitamin D? Is vitamin D we give injection to the newborn? Do we give vitamin D injection to every newborn? The options are yes, and the option is no. What do you want to answer? Perfect. Very good. Perfect answer. Question number one. Do you give any injection to a newborn? The answer is yes, sir. We give. Which injection? Do you give vitamin D injection to a newborn? No, 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 sir. No, no. Vitamin D. तो सर syrup आता है sir. Sir, syrup comes. We have syrup vitamin D. Okay, very good. Syrup vitamin D. What is the composition or how much do you give? Syrup vitamin, sir. For a term, anyone? How much vitamin D do you give to a term or a preterm baby? So yes, Bhavani, Pragya, Dogderm, Swaraj, and Rajalakshmi is very nice, very beautiful. You're answering. In a term baby, we give 400 international units, and in a preterm baby, we give 800 international units. The dose of vitamin D in a term and preterm is really very important. In the term baby, we give 400 IU, and in preterm baby, we give 800 IU. Very, very important. Remember that. सिरप आता है, सिरप देते हैं विटामिन डी का, इंजेक्शन नहीं देते. वी डोंट गिव इंजेक्शन विटामिन डी. इंजेक्शन विटामिन डी, वेयर डू यू वांट टू गिव? कैन एनीवन प्लीज टेल मी? इंजेक्शन विटामिन डी वैसे इन चिल्ड्रन इन पीडियाट्रिक्स डू यू गिव इंजेक्शन विटामिन डी? न्यूबॉर्न तो आई अंडरस्टूड, जस्ट नाउ यू टोल्ड ना, न्यूबॉर्न बेबी यू डोंट गिव इंजेक्शन विटामिन डी, you told you we give syrup vitamin D, right? So injection you give, exactly, yes. Where do you give? We give in the cases of rickets. Have you heard of rickets? Yes or no? Exactly. In the cases of rickets only, we give, very importantly, we give what you called vitamin D. Finish. Vitamin K. Osama ne bola 0.5 mg. Yes, Ricketts, you are right. Ricketts is the right answer. Osama said vitamin K. Can anyone tell me, please, what is the why do you give vitamin K to a newborn? My first question is, why do you give vitamin K to a newborn? My second question is, how much vitamin K do you give to a newborn? So very beautifully, Osama, you told me 0.5 mg. Like, do you want to say something else, or a 0.5 mg is the final dose for giving vitamin K to a newborn? Anyone? What do you think? आज जिम में मेरा होता biceps triceps. आज कोई जिम गया शाम को? Anyone went to gym in the morning, in the evening now? Anyone who likes to go to gym? Everyone likes to study? Very sad. I went to gym. See this. Yes. My gym instructor is very happy. He's like, you're working really hard. I was like, thank you, thank you, thank you. Yeah, so yes, that's very, Osama is right. Less than 1 kg. If the baby is less than 1 kg, the dose of vitamin K is 0.5 mg. If the baby is more than 1 kg, then the dose of vitamin K is 1 mg. ये तो है पहली बात, very, very important. Okay, less than 1 kg, 0.5 milligram, more than 1 kg, 1 milligram. Number one. Number two, why do you give vitamin K to a newborn? Why? Number one, breast milk. Breast milk is deficient in which vitamin? Breast milk is deficient in vitamin K, vitamin D, and vitamin B12. If she is a pure vegetarian, yes or no? We have done this multiple times, right? So breast milk is deficient in vitamin D, vitamin K, and vitamin B12 if she is a pure vegetarian. That is one reason I give vitamin K to every newborn. And second most important part क्या था? हाँ, newborn's liver. Newborn liver is immature. What is the function of liver? Liver basically helps in making vitamin K dependent clotting factors. Vitamin K dependent clotting clotting factors newborn liver form? What are the various vitamin K dependent clotting factors? Already who told? Osama, beautiful. Osama is answering so right. 2, 7, 9, 10. 2, 7, 9, 10. Vitamin K dependent clotting factors are 2, 7, 9, 10. Newborn's liver is immature and liver basically forms vitamin K dependent clotting factors. So liver is immature, so vitamin K dependent clotting factors newborn liver will not form, and that is why I give vitamin K to every newborn. And if I do not give vitamin K to a newborn, the newborn can land up into which problem? Who will tell me? If I don't give vitamin K to a newborn, the newborn will land up into which problem? He can land up into something known as hemorrhagic disease of newborn. He can land up into hemorrhagic disease of newborn. Have you heard of hemorrhagic disease of newborn, and have you heard of hemolytic disease of newborn? Could anyone please tell me? Hemorrhagic disease of newborn is because of vitamin K deficiency. If I do not give vitamin K to a newborn, it can lead up into hemorrhagic disease of newborn. The treatment for hemorrhagic disease of newborn is vitamin K itself. Less than 1 kg, 0.5 mg, and more than 1 kg, 1 mg. What about hemolytic disease of newborn? Can anyone please tell me hemolytic disease of newborn, which is the most commonest cause? क्यों हो रहा है hemolysis to a newborn? Which is the most commonest cause? Rajlakshmi, Manoj, Swaraj. Yes, yeah. Hemolytic disease of newborn is because of ABO incompatibility. There are various reasons for hemolysis. You remember we have covered in the jaundice class, even cephal hematoma also can cause hemolysis, and hemolysis means hemoglobin breakdown. Hemoglobin gets converted into heme, that heme gets converted into biliverdin, and that biliverdin gets converted into bilirubin. Yes or no? Even cephal hematoma also can lead to hemolysis and jaundice. Even ABO incompatibility, RH incompatibility, breastfeeding jaundice, breast milk jaundice, enzymopathies, membranopathies. Yes or no? Do you agree with me? All these problems will cause hemolysis. All hemolysis means hemoglobin breakdown, nothing but leading to jaundice, 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 jaundice. Okay? But the question, the exam question basically is the most commonest cause of hemolytic disease of newborn. The answer comes as ABO incompatibility. Means in my hospital, a baby comes to me with jaundice. Mostly I have seen that the mother is O and the baby is anything other than O. That only is ABO incompatibility. No, do you agree with me? Yes or no? So if the mother is O blood group and baby is anything other than O, A, B, or AB, that's what. So the ABO incompatibility is the most commonest cause of hemolytic disease of newborn, and vitamin K deficiency is the most commonest cause of hemorrhagic disease of newborn. That you should know. Take it done. Can we move further? Put a thumbs up, please. वक्त का पता ही नहीं चल रहा. 40 minutes. 40 minutes are over. Do you know that? And I have just started the topic. 40 minutes are over, and I only have 10 more minutes. Then we have to go for the audio class. Nice. So are you guys liking the class? Are we able to appreciate this class? Yes or yes, yes. Okay, let's start. So I was asking one very important thing. Very beautiful picture is this, where we are seeing various types of routes of giving injections for vaccines. Intramuscular, subcutaneous, intradermal, so many routes are there. No, so could you please tell me, very important, intranasal, guys, can you just very fast can we finish it off? Can you tell me at least one or two or any intranasal vaccines, my dear? Exactly, what do you think? Exactly, very good. Osama says yes sir, we all appreciate your class always. Thank you so much, Osama Sheikh. I'm nothing without your support. Everyone's support is really important, and we all are one family. That's it. Okay, share your knowledge. Don't really have the attitude that I will not share and she will get a rank and I will not get a rank. No, it's all about destiny. Okay, it is all about destiny. If you think that way, that she will get a rank and I will not tell her, that means you are degrading your own rank, because sharing is caring, and sharing itself will increase your knowledge, will increase your power. I am sharing knowledge with you. Can you imagine how many times I have finished this topic? At least by counting, more than 100 times I have taught this topic of vaccine. So who's the winner? Actually, I am the winner. I am learning too much, but from me you are learning, and from you will teach to someone else also. That's how it is. Hmm. Exactly. So intranasal vaccines, of course, H1N1 is something which is very nicely, basic answers. Influenza vaccine we give intranasal, and they are even saying COVID ka vaccine bhi aa raha hai. Some inhalational COVID vaccine is also coming. That, but that's under trials or plus minus. So at least inhalational in H1N1 is important. Oral vaccine. Can anyone please tell me very fast? Oral vaccine कोई है? हाँ, Aditya is right. COVID nasal vaccine भी आ रहा है. You're right. So I get, so oral vaccine number one, oral polio vaccine, very good. Osama is right. Do we have any other important oral vaccine? You only will answer, okay? I'll keep asking you, keep answering. That's all I want till your PG exam, your FMG and INI CET exam. It's all about that. Exactly. Hanji, very good. Yes. Rotavirus, right? OPV, right? रोटा कितने प्रकार का होता है? How many types of rotavirus vaccines do we have? Could you please tell me how many types of rotavirus vaccines do we have? Have you heard of Rotatech? Have you heard of Rotarix? Or have you heard of Rotavac? Yes or no? One is 2 doses, one is 3 doses, and all that. Yes or no? Rotatech, Rotarix, and Rotavac. Okay, so oral vaccines are OPV and rotavirus, very importantly. And even vitamin A also. Do you give vitamin A orally? Yes or no? And remember, guys, vitamin A doesn't come in vaccine. In general, I'm asking you that do you give vitamin A vaccine or do you give vitamin A orally? So the answer is yes, we give vitamin A orally. Can you please tell me the schedule for vitamin A? Vitamin A कैसे देते हैं? एज वाइज जो है कहीं सैम में देते थे. डू वी गिव विटामिन ए सिरप, विटामिन ए टू एवरी न्यू बॉर्न? इवन आई विल नॉट टेल. आई विल नॉट टेल, यू टेल. व्हाट इज द डोज? एक अच्छा क्वेश्चन भी याद आ गया. यस, क्वेश्चन याद आ गया. फर्स्ट टेल मी द स्केड्यूल ऑफ विटामिन ए. हाउ डू यू गिव? प्लीज कैन यू टेल मी व्हाट इज द स्केड्यूल इन सैम? Yes, beautiful answer. Perfect. I agree with you. So beautiful. So less than 6 months, 50,000 IU. Less than 6 months, 50,000 IU. 6 months to 1 year, 1 lakh IU. IU means international units. And more than 1 year, 2 lakh IU. Yes, that's true. This is the very important. See, every single word coming from my question is every single word coming from my mouth is an exam question. So ye already tha. If any one of you has covered the last 3 year question paper, they have asked this question. What is the dose of vitamin A in a 1 year old? Less than 6 months, 50,000 IU. 6 months to 1 year, 1 lakh IU. More than 1 year, 2 lakh IU. Do you want to add anything in this? Is this vitamin A schedule full, or are we missing something, or there's something left? Can we please tell me yes or no? Monimala says, sir, you can make this tea known as mountain tea. It's made with honey and ginger in warm water with tulsi leaf. Works amazing for your throat. Tulsi leaf is very important, sir. Okay, I have taken a screenshot for this. I'll tell my mom. She'll make a nice tea. But tea से gastritis तो नहीं होता. I don't take tea. I only take milk. 1 glass in the morning, 1 glass in the night. I never take tea or coffee because usually they say it causes gastritis. So let me know. Yes, the one thing is left. If the child is more than 1 year, if the child is more than 1 year and less than 8 kg, then what is the dose of this one? It will be half the dose. Normally, more than 1 year, you give 2 lakh IU, right? 2 lakh international units of vitamin A. But if the child is more than 1 year and less than 8 kg, then you give 1 lakh IU. Perfect. So, Osama, very good, Osama. So proud of you. Neil says black tea. Okay, buddy, black tea. जब मिलेंगे तो साथ में पियेंगे. नील, तुम कहाँ से हो? नील, where are you from? I'm very happy to see your message. तो या ओके, मैं अच्छा ये तो हो गया. हाँ, oral vaccines, rotavirus done, OPV done, and typhi oral. Oh, no one told about that. No, typhi oral vaccines. Exactly, typhi oral vaccine also you should know. Can you please tell me very fast? Okay, subcutaneous. Chalo, subcutaneous. Can anyone tell me at least 2 subcutaneous vaccines? Yes or no? 2 subcutaneous vaccine. Do we give MMR subcutaneous? Yes or no? Can we give what do you call IPV, injectable inactivated polio vaccine? Remember, okay, IPV. There are vaccines which can be given multiple routes also. The biggest example is IPV itself. IPV can be given IM, can be given subcutaneous, even some cases intradermal also. But the dose differs. Dear. Remember, yaad rahega? Yeah, exactly. So very beautifully people are answering. The MMR, yes. Chicken pox, yes. Meningococcal polysaccharide vaccine, Japanese encephalitis, yellow fever, and typhoid also. Remember, my dear friends, typhoid is given subcutaneous and also intramuscular. Typhoid is given subcutaneous also, it is given intramuscular also. Remember that. Will you remember this? Very good. So, please, are we able to appreciate this topic? Imagine, allow your brains. You're reading this for the first and last time. Imagine you are reading for the first and last time. This is only revision. So, can you please tell your brains that what are the subcutaneous vaccines? Close your eyes and tell me what are the subcutaneous vaccines. Okay, MMR. Okay, chickenpox. Okay, Japanese encephalitis. ओके येलो फीवर ओके टाइफॉइड इतना हम याद कर पा रहे हैं नहीं कर पा रहे यस ब्यूटीफुल वी कैन रिमेंबर दिस ब्यूटीफुल आई हैव अ क्वेश्चन हियर forget about intradermal abhi Rajlakshmi not intradermal I want to ask more questions chicken pox in a very busy OPD in a very busy OPD I would like to diagnose chicken pox guys can you please tell me how does a chicken pox rash appears and in a very busy OPD dekh kar look at the baby and tell the diagnosis so can you please tell me chicken pox in a very busy OPD how do you diagnose Rajlakshmi Manoj Surajana Swaraj and our dear Osama Sheikh. यस सो ओसामा ने पहले 3 से लिखा फिर उसे काट दिया नो प्रॉब्लम वेरी गुड काटा है वरना तेरे को मैं काट देता एग्जैक्टली यस सो वेरी ब्यूटीफुल यूर आंसरिंग कैन वी अप्रिशिएट अ मैक्यूलो पैपुलर और क्या था वेसाइकुलर रैश यस और नो मैक्यूलो पैपुलर वेसाइकुलर रैश एंड लेटर क्या बाद में क्या होता है दीज ऑल वेसाइकल्स गेट क्रस्टेड यस और नो and kind of pleomorphic rash. What is pleomorphic rash? Pleomorphic rash is a rash where all the stages, different stages of rash can be seen at the same time. Different stages of rash can be seen at the same time. Means in one arm I'm having macule, here I'm having a papule, here I'm having a vesicle, and here I'm having crust. Very importantly, right? This is nothing but very importantly chicken pox. And mother will give what history? Mother will say pani wale dane. Pani wale dane. In English we say, doctor, he's having some rash where little watery discharge is there, doctor. So maculopapular vesicular rash. And remember, even pleomorphic rash you see in Kawasaki also. In Kawasaki also you can see pleomorphic rash. But chickenpox rash is different basically. It is vesicular and Kawasaki rashes are non-vesicular. Kawasaki rashes are non-vesicular. That's true. And in Kawasaki, do you see thrombocytopenia or thrombocytosis? Again, very important. See, whatever important questions are coming in my mind, I'm asking you back to back, back to back, back to back. Okay, so that we can finish the whole topic. In Kawasaki, Dr. Osama and Dr. Priya, in Kawasaki, which is the inflammatory marker in Kawasaki? Which is the inflammatory marker in Kawasaki? And do you see thrombocytopenia or do you see thrombocytosis? कौन बताएगा? Who will tell me? Tell me fast, fast. Very good. So beautiful. You're answering. So nice. माई मोबाइल कर रहा हूँ लैपटॉप का बैटरी चला मैं चार्ज पे लगा लूँगा yes exactly who will tell me very good thrombocytosis the inflammatory marker in a case of Kawasaki is thrombopoietin याद रहेगा नहीं रहेगा the inflammatory marker for Kawasaki is thrombopoietin and that is why you see Kawasaki में thrombocytosis how do you diagnose Kawasaki last question how do you diagnose Kawasaki Swaraj Surjana Sonia Rajlakshmi Manoj Osama and Sonali Patra how do you diagnose by some test कराएं CBC कराएं CBC कराएंगे what how do you diagnose what is the one line answer would you like to give me for a diagnosis for Kawasaki जगह नहीं मिल रही मेरे को लिखने के लिए आई एम नॉट गेटिंग स्पेस टू राइट यस Kawasaki is a clinical कहाँ लिखूँ मैं it is a clinical diagnosis very important it's a very important point clinical diagnosis can you tell me two more conditions which are clinical diagnosis clinical anyone Osama two more conditions where the diagnosis is clinical diagnosis number one is Kawasaki number two is have you heard of HSP Hinong Schonlein Purpura कैसा आता है HSP का बच्चा palpable purpura lower limbs everyone knows about it I assume everyone knows about it if you don't know message me I'll tell you so three things clinical diagnosis Kawasaki HSP, Hinong Schonlein Purpura. Even SAM also remember. Everyone knows WHO defines SAM as weight for height less than -3 standard deviation and mid upper arm circumference less than 11.5 plus minus edema. But in general, this baby is kwashiorkor, this baby is marasmus. How will I diagnose? Clinical diagnosis. Fully NSR ka will be kwashiorkar, mota bacha. Only tummy fatty, like abdominal distension, but baby is very skinny will be marasmus. Fully NSR ka kwashiorkar, and skinny baby marasmus. Not fully, but here he'll be having a pot belly, and here he'll be having very old man faces, monkey faces, baggy pant appearance. Yes or no? Are you understanding? Hello? Yes. So, three conditions, clinical diagnosis, HSP, Kawasaki, and severe acute malnutrition. Perfect. Let's move further. Okay, acha, intradermal. Wait. Now coming to intradermal vaccine. I think 5 more minutes, then this time only is over. What to do? Okay, perfect. So can you please tell me what are the vaccine given intradermal? Intradermal कोई देते हैं vaccine हम? Do we give any vaccine intradermal? Yes, very good. कौन सा देते हैं? Exactly. Perfect. Swaraj is answering so nice. Very good, Swaraj. Very good. Intradermal vaccine. Can we think of BCG? Yes. BCG के अलावा who is answering? Priya is answering. Very good. Rabies. Rabies also is given intradermal. Rabies. Remember, dear, if I say rabies given intradermal, could you please थोड़ा सा और tell me about rabies में every rabies vaccine is given intradermal? I have a question here. I have a doubt. I am a NEET PG student. I have a doubt. रेबीज वैक्सीन मतलब एनी टॉक बाइट केसेस। ऑस्कर क्लास चल रही है मेरी, प्लीज डिसिप्लिन। So any rabies vaccine, every rabies vaccine is given intradermal. Osama, could you please tell me? Priya, my question is, every rabies vaccine given intradermal? No, you meant that only, right? Are you sure? Like, can we have some extra line here or something like that? शायरी नाम है, शायर, योर नेम इज शायरी, क्यूट। तो शायरी से अपडेटेड थाई रेजिमेंट, नहीं वो तो समझ में आ गया, बट मेरा क्वेश्चन है कि हर रेबीज वैक्सीन को हम इंट्राडर्मल देते हैं, मतलब कुछ डू वी हैव समथिंग डिफरेंट? ओके, वी हैव समबर्थ कुमार मंडल सेज कुछ आईएम कुछ इंट्राडर्मल। हाँ, तो कुछ आईएम, हाँ, हु इज आंसरिंग दिस? निशी अग्रवाल, वेरी गुड। So remember, anti-rabies vaccine is given intradermal, but anti-rabies serum is given intramuscular. Yes or no? Do you agree with this line? Yes or no? It's very important. It is okay. Anti-rabies vaccine, that is 0, 3, 7 and 28 modified thigh regimen जो हमारे हॉस्पिटल में गवर्नमेंट में हम, this is what we follow. We have a proper chart of the rabies schedule. Day 0, day 3, day 7, day 28. If you are a newcomer, we have done the rabies class of 1 hour topic we have done on rabies. Please watch the previous video. इतने सारे videos हैं before they all go private and locked, because everyone is watching them back to back nowadays. So that's what, watch them ASAP before it gets locked. So क्या था? Rabies vaccine. One is anti-rabies vaccine, anti-rabies serum, anti-rabies vaccine given intradermal over here, intradermal. Okay, intradermal, which in this picture, अच्छा ये लिखा ही हुआ है मैं क्या ही पूछूं, लिखा हुआ है इस पे तो 15 degree. Okay, intradermal, like that intradermal we give. Okay, an anti-rabies serum intramuscular. What is the dose of anti-rabies serum? Manoj, प्रतिभा, सोनाली, स्वराज, भवनी, डोज क्या होता है यार, मुझे याद नहीं आ रहा। डू वी हैव एनी डोज ऑफ एंटी रेबीज सिरम, और सबका एक ही होता है? Exactly. Can you remember 20 and 40? 20 IU per kg for human rabies immunoglobulin and 40 IU international units per kg. 20 international units per kg is the dose for human rabies immunoglobulin anti-rabies serum, and 40 IU per kg, 40 international units per kg is the equine, घोड़े वाला horse वाला equine rabies immunoglobulin anti-rabies serum. Are you understanding? Please, we have anti-rabies vaccine, anti-rabies serum. Anti-rabies vaccine is given, vaccine is given intradermal when? Day 0, day 3, day 7, day 28. Whereas anti-rabies serum is given IM, 20 IU per kg you can give कौन से वाला? Human rabies immunoglobulin, and 40 IU per kg you can give which one? Equine rabies immunoglobulin. It depends which one is available in the hospital. And a little more, I think I only will tell you. Okay, yeah. Anti-rabies serum is given IM. No, do you know this point, right? Half is given over the wound and half is given local IM. Do you remember this point? Yes or no? Am I making sense to you? एंटी रेबीज सिरम जो आता है, वॉट एवर 20 IU per kg human rabies immunoglobulin, you got the answer. Half of that dose will be given over the locally over the wound. If I've got a dog bite on my right thigh, half of that serum will be over locally over the wound, and half you will give in my buttocks. Half you will give intramuscular. Very, very important. Done. Finish. Next. So the vaccines given intradermal are very importantly BCG, very important rabies, and very important IPV. And what is IPV? Inactivated polio vaccine. Don't say injectable. Say in examiner wants to hear only inactivated. Don't say injectable. Okay. Don't say injectable. Perfect. Next question. Yeah, 2 more minutes and this class is over. Yeah, IEM vaccine. Can you please tell me any important examples of IEM vaccines? Surjana, RR, Nishashri, Sonali, Swaraj, Mansi. In IEM कोई होता है कि कोई नहीं है? Hmm. Yes, all T's, all T's. Hepatitis A, hepatitis B, TT, और क्या है, पेंटावेलेंट, है ना? So all these are all the T's basically you give IM, okay? Pentavalent, hepatitis A, hepatitis B, TT, Haemophilus influenza B, pneumococcal vaccine, DPT, TT, all these are given intramuscular. All these are given intramuscular. Are you understanding? Perfect. Very good. Yes. And do we have any vaccines which are given both subcutaneous also and intramuscular also? I told you in between there are vaccines which can be given both only. Yes. So IPV can be given both. PCV, the pneumococcal basically vaccine, pneumococcal polysaccharide vaccine, PCP, PCV, IPV, they can given both subcutaneous also and intramuscular also. Subcutaneous also, intramuscular also. Perfect. Very good. Yeah, very easy. Again, where all our exam questions. Okay, which route of vaccines we don't use? So many routes you got, no? Intranasal, subcutaneous, IEM. Yeah. So which intradermal? Which route basically we don't use? Anyone? Yes, everyone knows about it. Beautiful. The best answer is intravenous. Intravenous, there is no IV vaccine. You never ever give intravenous vaccine. That is the first point. Next question. What are the light sensitive vaccines? Who will tell me? Swaraj, मनोज, वेरी गुड. प्रिया, व्हाट आर द लाइट सेंसिटिव, जो लाइट से रोशनी से बहुत प्रॉब्लम होती है? एनीवन? हैव यू हर्ड ऑफ रोटा वायरस? हैव यू हर्ड ऑफ BCG वैक्सीन? यस और नो? व्हाट आर द वेरियस लाइट सेंसिटिव वैक्सीन? लाइट से सेंसिटिव हैं बहुत ज़्यादा. आई शो यू वेरी नाइस पिक्चर. दिस इज द पिक्चर. Please, can we imprint this picture in our brains, in our tiny brains, in our beautiful, mind-blowing $100 million worth tiny brains? Can we put this information? Number one, tell your brains you have a very good photographic memory. Tell your brains you have a very good photographic memory. Acha, okay. Do I have? Oh, that's nice. Yeah, that's very nice actually. So look at this picture. Look at this picture for 5 seconds. BCG, DTAP, HPV, MMR, Rota, light sensitive vaccine. Now close your eyes. Close your eyes. Everyone close your eyes. How much can you remember? Close your eyes. दिख रहा है, खोल रखी आंखें तुमने सामने. Close your eyes. कितने? How many do you remember? Do you remember BCG? Do you remember DTAP? Do you remember HPV? Do you remember rotavirus? And do you remember this one MMR? मुझे तो सारे याद हैं. क्या आपको सारे याद हैं? सवाल ये है. Exactly, beautiful. Yes, that's right. These are the light sensitive vaccine. That is why even MMR की जो bottle होती है ना, the bottle of the MMR is amber colored. That's what. Even the BCG vial also is little not the transparent. It is little different, light brown or dark or amber colored. That's why, because it's light sensitive. That's why it's amber colored. Beautiful. Very good. Very nice. Okay, perfect. So okay, what is the substrate? Very important question. What is the substrate? Okay, कौन सा पूछूं? ओके, पहले बताओ BCG का सबस्ट्रेट क्या होता है और मीजल्स का सबस्ट्रेट क्या होता है? लास्ट क्वेश्चन. ऑलरेडी 9:25. द क्लास इज ओवर नाउ. वी हैव टू स्टार्ट अवर ऑडियो क्लास. इफ यू गाइज आर फ्री, प्लीज कम एट 9:30 PM. At 9:30 PM we're gonna talk more about vaccines. Today let's talk about more about vaccine. Finish it off. I'll be asking you a lot of questions on this one, dog bite, what are the categories. Very easy. It's very easy. We'll talk in the audio class. Okay, don't worry. हाँ जी, बताओ. Just 2 more minutes. What are the preservative for measles and BCG? Perfect answer. What is the perfect answer? Osama and this one Bachel gave. What's your name? Japu Panchal. Like, is it Japu only? Japu, JPU. Malab, is it a Bengali name? I don't know. Japu. Am I pronouncing the right thing? Okay, we have a ID. He says, where is the audio class, sir? In the Android. Number one, you need to have an Android phone for that audio class. Number two, if you have an Android phone, download Unacademy. Download Unacademy. On the Unacademy homepage itself, there is an option known as Open House. There is an option known as Open House. Once you open the open house, automatically you'll see my face, my this picture, and there it will be written join the room. You have to just join the room. It's totally free for every single person on this planet. Yes, 2 days back we had students from Malaysia also who had come online, and we spoke very nicely. Nothing we do, we just sing songs and poems and stories, and we talk little about studies and make the class little light and little comfortable. That's what. ओसामा आ जाना, तुम तो इससे सवाल पूछूंगा. ओसामा अच्छी से शायरी सुनाएगा आज. ओसामा प्यारा से सुनाएगा शायरी अच्छे से. मैं भी सुनाऊंगा, गूगल से देख के सुनाऊंगा मैं अच्छे से. ठीक है, परफेक्ट. So yeah, measles and BCG, basically measles and BCG have no preservative, and most importantly ये जो exam में ये this was the IAP quiz question. One of my junior, he joined IAP quiz, All India level Indian Academy of Pediatrics quiz. There were asking what is the preservative used in DPT. Thiomersal. Thiomersal is the preservative used in DPT. Thiomersal. Okay. Yes. So yeah, thiomersal is a preservative used in DPT. That's important. And what is the adjuvant? A for adjuvant, A for aluminum hydroxide. A for adjuvant, A for aluminum hydroxide. DPT ka adjuvant is nothing but aluminum hydroxide. That you should know. Okay, here only I would like to ask a question. Which is the vaccine? Imagine there are 4 babies. One baby got DPT vaccine, one baby got measles vaccine, one baby got BCG vaccine, one baby got OPV vaccine. Which baby will cry the most? A, B, C, D. A baby will cry the most, B baby will cry the most. Which baby will cry the most in a case of if all 4 have got the vaccination? Hmm. Exactly. Everyone knows about it. Which vaccine causes incessant cry? Incessant matlab inconsolable या बहुत ज़्यादा very bad cry or too much painful. The most painful injection is usually DPT. But usually children come to my home for private OPDs and for this one what you call for vaccination. वो उनको तो दर्द नहीं होता. This patients mothers are very happy with me. They say Dr. Anand आपसे दवाई injection से रोता ही नहीं है ये, and no fever also he gets. I was like, thank you. That's what. And you know the best part of being a pediatrician, whenever I give injections to my parents, to my mom, dad, putting a IV line, putting IM injections, they don't feel pain at all, because naturally, no, because we give injection in children, no, so we know how to give the smallest needle with less painful, and the way we put it cannula and all that. So my mother also, she like dard hi nahi hua, pain hi nahi hua and all that, because as pediatrician we use very small cute needles. So for adult they feel very less pain. So that's very one magic actually. Yeah. So I think that's enough. It's 9:28. We're gonna end up here. Only I'm gonna revise this slide. Question number one: which vaccine causes most cry? The answer is DPT. Which vaccine causes seizures in a baby? Any mother who has just got a baby vaccination done and baby got a seizure. Which vaccine is mostly responsible? Pertussis. In the DPT, pertussis is very notorious. Pertussis is very notorious. ठीक है, मैं मोबाइल निकालूं अपना. You guys also open your mobile, okay? Because open house में आना है. Hmm. Hmm. DPTP is very notorious, and that's it. It's 9:29. Thank you so much, everyone. And in the tomorrow I'll be on a break. Tomorrow is 1st April. I'll be going out movie with my wife, and we might go for RRR. Which one should I go? RRR or should I watch at home KGF? Let me know in the comment section if you feel which movie is good. And before leaving, we have a motivating quote. We both are actually. There's too much to remember revise. In the upcoming classes, we will revise this. I'm just looking for the motivating quote here. 1 second. And yes, exactly. So this is the motivating quote for tonight, my dear friends. The today's motivating quote before leaving is nothing but love yourself. Love yourself, because you are the only person who is with you for your entire life. So love yourself. Self-worth. self praise and self love is really very important. I will not say कि become very adamant. चिड़ मत जाओ, ego मत रखो. Don't keep ego, don't keep be adamant, don't be negative, don't be greedy, but at least accept yourself, at least love yourself, at least be happy with yourself. Self alone company is best. Okay, self company is best. I, as a friend, I will always recommend you, don't depend on others. Don't depend that if you will sit with me then only I'll be fine, otherwise I feel so bored, please be with me and this and that. No, self love is important. You want to have food, have alone, relax. If someone is having with you, that's very great. It's nice if someone have food, lunch, or spending time and memories or sharing something with you in life. But don't be so addictive that if someone left, then you are like stuck there and thinking that, oh, now I'm feeling alone and this and that. No, self alone is best. Love your company. So that's what the quote of the story is: love yourself, because you are the only person who is with you for your entire life. So either you can make your mind very destructive, or you can make your mind very constructive. So what do you want to do? You want to make very beautiful aura, or you want to be like very sad? Let me know. Okay, so yeah, April Fool, कल है April Fool, 1st April, कल बनाएंगे April Fool. And yeah, this one, yeah, so please come at, it's 9:30 now, within 5 minutes, please come. Where is my Android phone? I'm opening my Android phone. Please come on the अपना Unacademy Android app, and let's talk for some time, little bit on vaccines and general questions. Thank you so much. Take care and bye. ख्याल रखो.